Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.
Okay, now then, natural treatment for autism, ADHD, ADD, dyslexia, dyspraxia, depression, and schizophrenia. Okay, sounds good to me. Hopefully it sounds good to you. And I would like to say that I'm joined by our nutritionist and medical herbalist, Mr. Gabriel McSharry. How are you?
How are you, Johnny? Good morning.
What is the weather like in Sligo today? You heading to the beach or what?
Fantastic. It's beautiful.
Okay. Now, the natural treatment for autism, ADHD, ADD, dyslexia, dyspraxia, depression, and schizophrenia. It's hard to get all those names and letters off your tongue, but tell us more.
Sure. I mean, this is the subtitle of a book by a medical doctor in England, Dr. Natasha Campbell-McBride. And I've had the privilege to spend some time with her in her clinic over there in Cambridge. And it's quite an amazing line of nutrition for me anyway to explore, in that all these conditions that are generally unfolding epidemics today, they're largely on the increase, and things like, you hear a lot about them in school, this attention deficit disorder, hyperactivity disorder, and dyslexia, dyspraxia. And there's so many names and so many things fit under, I guess, a spectrum called autism spectrum. She, just to give a background on her, and then that'll describe, I guess, what her book is about, is that she had a son herself who was diagnosed with autism, quite young, I think at 3 years of age, and she's a neurologist and a GP, and she couldn't find anything in her own arsenal that had any great improvement for her child. So went back to college, did a master's in human nutrition, and set out on a journey really to explore how diet and nutrition could be a treatment for all these conditions. And was successful. Her son is now a normal boy at university and drives a car, has a girlfriend, and so on. And so it's actually an amazing story, and she covers it in her book. And the book is called Gut and Psychology Syndrome. And her name is Dr. Natasha Campbell-McBride. Now, it sounds like an Irish name, but she's actually Russian. But quite an amazing feat of research that she done over all them years, and she devised a diet that works very well for people with this disorder, and it extends to depression and schizophrenia and other bipolar neurological disorders. And she has a very busy clinic now in Cambridge in England. She can't see the volume of people anymore. They're flying in from all over the world. So she's now trained up other practitioners, and in Ireland she refers people to me. Well, in the north half of the country anyway, and there's some practitioners in Cork. It's a very effective protocol.
Okay, I know, just looking at the title there of your article, I know that a lot of people will be on medication for schizophrenia and depression and so on, but I wasn't sure, I wasn't aware, and excuse me, Gabriel, that people with autism would have medication.
Yeah, I mean, there is, and I mean, a lot of them, I think it's trial and error really to see is there an improvement, but I guess the attention deficit and hyperactivity and Asperger's, all these go in under the umbrella of autism spectrum, and they do use pharmaceutical drugs in this realm that are Ritalin is probably the most famous one I know of offhand. They're mainly stimulants, but for these individuals they have a calming effect. There is, as much as I'm aware, there's nothing, however, that they take that brings them back to a normal state. You know what I mean?
Well, you're a nutritionist and a herbalist. I mean, have people came to you who have children that are schizophrenic or have the autism and asked to help, and maybe asked you, is there anything you can do for them?
Sure. Well, it was only at Christmas time that I was over with Natasha in England, and since then, I did a workshop with her where she kind of trained us up. There was 40 of us, mainly medical doctors from all over. There was 2 doctors from Singapore, 1 from Dubai, some from the States, and there was 3 of us from Ireland. And she trained us in her protocol. And now, since then, I guess if people contact her via her website or have read her book and want to see her, she refers them to us. So since then, since Christmas, I have seen quite a few, and it takes a bit of time, the protocol. Like, I mean, you're talking a couple of years, but mainly the important thing is that it's a dietary it's a natural protocol. So from my standpoint, I have no problem recommending it. If anything, it'll do no harm.
Yeah, and how does that diet different? We'd say, obviously she looked after her child, as you said there, who had autism and changed maybe his eating habits and so on. But what's the difference between, we say, of what she did and what you could do than a normal child would have, we say, for dinner, breakfast, dinner, and supper?
Sure, good question. I guess it's quite a complex protocol, but if I was to boil it down into a high level of looking at it, it mainly takes out sugars, processed foods, and grains. And what she's found is that individuals who have these conditions, they're sick people physically as well, as opposed to the mental aspect, and they all 100% have digestive problems. And I mean, it's well documented in the medical literature. I think 92% will have some sort of either diarrhea, constipation, colitis. Digestive problems are endemic in these individuals with these diagnoses. So if you look at it from that perspective, if you treated the digestive problems and see how that went and fix them up, would it have a beneficial effect on the neurological or the mental problems?
And it's not going to happen overnight.
No, it takes time. These things sometimes take time to develop, but it takes time to fix. And basically, the basis of it is to balance the ecosystem of the digestive tract. So we have between 400 and 500 different microorganisms in our gut microflora, and that needs to be balanced. These things we need, they comprise 80% of our immune system. When we take processed foods and high sugar diets and certain drugs and chemicals that are in our environment, they damage the gut microflora. And when this happens, then pathogenic microflora take their place, and it sets up an ecosystem where and these microorganisms are like us. They eat and they excrete, and the things they excrete are toxins, and these toxins go in over the gut lining into the blood system. And in these individuals, they cross into the brain, and they can cause a lot of problems. It's the basis of it, and the basis of the approach is to change the diet in order to change the ecosystem of the gut back to balance. So getting out all the bad guys, we'll say, and get back in the good guys, and heal the gut wall. If there's any damage to the gut lining, heal this. And in time, these toxins stop going into the system, and in time, the people will detox themselves, and in time, their symptoms will improve. Okay,
what have parents been saying, we'll say, that have come to you with a child with autism or dyspraxia or dyslexia or whatever, and that the diet has been changed and it's now a couple of months or maybe a year? Have they said there has been improvement? Have you seen improvement?
Sure. Now, it's important to note that I've only been using this protocol for a few months, and therefore I wouldn't be a good gauge on the efficacy of it. But if I was to just emulate Dr. Natasha's practice, who's using it for 20 years in her practice, she has returned people back to normal health. she does feel there's a critical time, like nearly a point of no return, that if a child has these conditions of a very early age and is now an adult, they have missed out on important years where they learn certain subconscious skills and how to communicate with others and so on. And not that it's not possible to turn that around, but it's just very, very hard when they pass a certain point in and a certain age. But she has seen amazing things in her practice. She outlines them all in her book. I personally have seen quite amazing success rates with people with autoimmune conditions, so people with ulcerative colitis and Crohn's disease and these digestive problems have completely resolved, and I have patients who are completely medication free who've had ulcerative colitis and Crohn's disease and really severe autoimmune conditions. So it's to extrapolate that protocol onto people with neurological conditions like autism.
And it's not just autism we're talking about here, but according to your article, you're talking about depression as well and schizophrenia.
Exactly, and now the research is exploding in this area, and it's very interesting in that, does the gut microflora have an effect on depression and schizophrenia? And it's shown that it does. So it's a brilliant area of research at the minute. It's very complex. We know of about I mentioned there's 400 to 500 different microorganisms in the gut. We know of about 40 or 50 of them well. What they do, what their names are, what their function is. There's a wide area of that ecosystem that we don't understand. And until we get down to what exactly these things do, there's a big area there of research, but they are researching it now. They're using the Genome Project now. They're mapping genetic transcriptions of people's gut microflora. It's very complex, and it changes through the gut microflora we might have here in Ireland per se may be different than someone who lives on an island in Thailand, in that you're obviously you're exposed to a different environment. The soil has different microorganisms in it here than it does in the tropical region per se.
Just looking at a text here, sorry to interrupt there, just looking at a text that says, there's probably a lot of truth in what Gabriel McSharry is saying there, because I have a child, a little girl with autism, and I suppose there's, like every other child, that she is hyperactive. These are the words this caller is texting here. My child has autism, is hyperactive. Obviously, when I reduce sweet things, it's less of a problem.
Yeah, for sure. Sugar. The unfortunate thing too, Johnny, to point out is these children, generally who have these conditions, crave sweet things. They crave breads, chips, pasta, starchy stuff, grains, and sweets, or fruit, sweet things. Now, it's unfortunate because they crave the things that are really doing the damage, in my opinion, and it's not an easy road. But when you wean the child off these and onto nutrient-dense foods, where their gut wall repairs itself, and then the body begins to get rid of the toxins, they begin to put on weight. Their digestive system heals up, so if they have severe diarrhea, it stops. If they have severe constipation, it normalizes. And all parents out there, I'm sure, listening today with a child with autism will attest that their digestion, their bowel motions are pretty bad. And so it's very much a dietary protocol to fix the digestion, and fix it on a physical level. And that has massive benefits to the behavior of the child.
Okay, just before you go as well, I just want to ask something there. God, it's gone out of my mind. Oh yeah, the book. By the way, this book is by Dr. Campbell McBride. Is it widely available, the book? Because I'm sure a lot of people listening to this program today, and this insert on the program, we're talking about schizophrenia, depression, autism, whatever, would like, I suppose it would be a good read for anybody who has a child with autism. Is the book widely available, Gabriel?
It's available on Amazon.com, which is the biggest online bookstore. It's available from Natasha's website herself, I think, and get your local bookstore to order it in. It can be ordered. It's easy for a bookstore to order. Put it that way. It's out there. It's not hard to find, and but probably the internet is the quickest and most convenient.
And it's called Gut and Psychology Syndrome.
Sure, Gut and Psychology Syndrome by Dr. Natasha Campbell McBride. I mean, I'm happy to give people out the reference to the book if they're in the clinic. They should find it pretty easily on the internet. Okay,
and we'll give your details just in a moment. Gabriel, as always, thank you for your time.
Thanks, Johnny.
You're very welcome, and a very good morning to you. Yes, that is Gabriel McSharry. Gabriel McSharry is a nutritionist, and he's well sought after, and he's also a medical herbalist, and he's got a clinic there in Cowrie and Sligo. By the way, he said if you give him a call there, he could outline some points in the book maybe to you if you have a child with autism. As maybe it could be your child, it could be yourself suffering depression, schizophrenia, whatever, ADHD, ADD, dyslexia, dyspraxia. A lot of the stuff they say, you heard the old saying goes, and I say, what you are, what you eat is what you are, that kind of thing, and but then again, if you have a child with autism, and I suppose if this helps in any way, you will do your best as a parent to help the child. I know they've sweet tooths like us all, and it's hard to take them off the chocolate and the cokes and that, but it does make people hyperactive. But if it helps, it helps. And in this case, there's I suppose food for thought, if I can put it that way, because Dr. Campbell McBride has a book out at the moment called Gut and Psychology Syndrome, and she has a child with autism, and she changed the child's diet completely, and the child seems to be doing absolutely wonderful now. And as a student at college, I'm not saying that it could be just it's not a once off. It's proved. And anyways, that's the best thing to do is go on that on Gabriel's site there, and he will direct you, maybe have a chat with you. It's www.westernherbalmedicine.com. That's Gabriel's site. 3 W's in the dot. westernherbalmedicine.com.
The Johnny Ouston Radio Show with Shaw's Department Stores. Quality brands, quality service.
Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.